I'm Chief of Cardiology here at Coordinated Health, and I'll be seeing patients at the Bethlehem Hospital campus on Highland Avenue beginning in November of 2011. I have always had a fascination with cardiology. I can remember as a child being fascinated and studied the circulation of a salamander in my basement when I was about 8 years old. I just remember looking at this little salamander and seeing through this very thin skin its blood vessels, and I wondered just how the whole thing worked. I went to college at the University of Pennsylvania and completed my medical education at Temple University School of Medicine. When it came time to follow a specific path in medicine, I found myself naturally studying the heart and vascular disease and finding a great interest in that, and I never looked back on that decision. I did my internal medicine residency at Dartmouth and my cardiology fellowship at the University of Washington. I spent several years on the faculty as a cardiologist at Dartmouth Hitchcock Medical Center and Medical School. I thought I would actually spend most of my career at Dartmouth. I really loved it there and had trained there and had a really good academic opportunity at a major medical school. But I found that rather than sort of blend into the academic background, I really needed to make my own space, my own spot, and my own contributions. And the thing that I enjoyed most was taking care of people. So I returned to the Lehigh Valley in 1985 and founded Valley Cardiology Associates, our private practice, which continued for 25 years. I spent 5 years working at St. Luke's Cardiology Associates. I think that we have a unique opportunity to bring together in a specialty hospital system, which is owned and run by physicians largely, to focus our goals on bringing together in a collaborative way a variety of different areas of healthcare to benefit the overall well-being of our patients. I think coordinated health offers a special blend of values and excellence. Patient is really at the center of our experience and our mission. The opportunities that we have here to practice the highest level of medical care at the same time as we maintain as central our patients' well-being and our value system is a tremendous attraction. We try to do what we do well, and we intend that whatever we do, we are going to do well. I'm hopeful that our patients will find in me, in my colleagues, and in our cardiology division a program that will provide a form of integrated care that will bring together our primary care physicians, our specialists, and particularly our cardiologists to enable patients to have a very user-friendly environment and understand that their healthcare providers will be talking to each other, and talking to each other in a way that keeps their interests at the center of what we're doing. I think the thing that fulfills me the most is making people better. I genuinely have an intellectual interest in medicine and in cardiology, but I think the thing that makes me smile and feel best inside is knowing that I can make a difference in people's lives.